Hello everyone, it's Ravi from the Royal Pharmaceutical Society and I'm back today with one of my COVID-19 updates for pharmacy. These updates are changing from daily updates to twice weekly updates on a Tuesday and Friday, so do keep a lookout for them going forward. Some key updates that I thought would be useful to give people insights into through various publications and announcements from government and NHS over the last few days. The government published their COVID-19 testing strategy over the weekend. There was a number of references to NHS key workers, and we know that pharmacists and their support teams are key NHS workers. We continue to talk to government around clarifications around timescales of this implementation and what this will mean for pharmacists and their support teams. And as soon as we have more information on this, we'll be able to provide you that as soon as possible. The RPS has been working with BBC News and various media outlets around the lack of access to PPE for pharmacy teams across the entirety of the NHS. And while we appreciate that social distancing requirements, implementation of those requirements is absolutely essential and key to reducing the transmission of COVID-19, we do want to see that pharmacy teams are able to get rapid access to high quality PPE when needed and when appropriate to do so. There was also alert from the NHS in England around indemnity insurance for frontline clinicians against COVID-19. We're currently waiting for some updated FAQs from the Department of Health and Social Care around what this means for pharmacists and their support teams. Once we have that information, we'll be able to share that with you more widely. We know that also over the weekend period, community pharmacies in England were found out that they would be needing to open during Easter bank holiday. NHS England and NHS Improvement announced that community pharmacies in England needed to open between 2 p.m. and 5 p.m. on the 10th of April and the 13th of April as well. And more information around this is on the Royal Pharmaceutical Society's website as on the PSNC's website. We know how hard pharmacy teams have been working over the last 3-4 weeks to manage the COVID-19 pandemic, and I appreciate this announcement hasn't given many people enough time to prepare for this, and I know people are really tired, they're burnt out, and many people were looking forward to having some downtime and rest over the weekend. I'm personally concerned about the mental health and well-being of pharmacy professionals on the front line, but also the rapid need to find cover and support staff to enable you guys to open during these hours. I really hope the NHS and government recognises this last-minute approach is less than ideal and not great, and support pharmacy teams to be able to manage the increase in demand that's going to take place over the weekend period. NHS England have also just released some further information around the NHS Volunteering programme. The RPS will be producing a statement around volunteering programmes across England, Scotland and Wales very shortly. Key updates from the Royal Pharmaceutical Society. We've been doing lots of media work and radio work around recognition of the profession, PPE access, COVID-19 testing and protecting pharmacy teams as well, and particularly stories around reducing abuse in pharmacy settings as well. So do check out the RPS website. There's loads of those stories available on there for you to have a look at. We're running a series of webinars this week that are focused on helping pharmacy teams deliver services during COVID-19. We have one this evening from the Neonatal and Paediatric Pharmacist Group on the management of COVID-19 in children, COVID-19 clinical trials and safeguarding in paediatric medicine. We'll also be looking to do a webinar tomorrow with NHS England and Improvement around treatment of COVID-19, opinion-based versus evidence-based medicine. And we'll also be hosting a series of engagement events this week on Facebook and Twitter, and it provides an opportunity for members and the profession to let us know what support you need over the coming days, weeks and months. If you have any ideas, please do send them over to the RPS support line via email or through phone. Also to announce, yesterday we launched and unlocked a series of pharmacy guides and the MEP online version for all members of the profession and the wider healthcare family to help support you during the COVID-19 pandemic as well. So once again, thanks everyone for all their work on the front line. I know it's going to be a tricky week leading up to Easter. We are here to support you as best as we can, so do keep in touch and let us know how we can potentially help. Once again, I shall see you later this week on Friday. Bye.